Hello class, my name is Sabrina Gomez and I will be presenting on anabolic steroids. So what are anabolic steroids? They are synthetic versions of the male hormone testosterone, and they're medically prescribed to treat issues such as muscle wasting in AIDS patients. They also help with wound healing in elderly, and they treat low levels of testosterone in males. The common use for anabolic steroids is to build muscle illegally without the guidance of a doctor. Some common names for anabolic steroids are gear, juice, roids, and stackers. So the most common types of steroids we see here are the commercially available ones in the US. And within the illicit anabolic steroid market, there are many more that are being abused. That includes steroids which are not commercially available in the US. So steroid abuse. Steroids claim to increase lean body mass, strength, and aggressiveness. So this makes it possible to train harder and therefore further improve strength and endurance. Steroids are also believed to reduce recovery time between workouts. So how are steroids taken? They can be taken in several ways. The most common amongst athletes is intramuscular and subcutaneous injection. And people abusing steroids may take doses that are 10 to 100 times higher than doses prescribed to treat medical conditions. The doses of anabolic steroid use will depend on the particular objective of the steroid user. For example, athletes, they usually take steroids for a limited amount of time and then to just achieve a particular goal, opposed to bodybuilders, law enforcement officers, bodyguards. They take it for a longer extended period of time. So different methods of steroid use. Some athletes think that they can avoid the unwanted side effects and maximize the drug by using some of these methods, such as cycling, which is taking doses for a period of time, stopping, and then restarting. Stacking, which is combining two or more of the different types of steroids. And pyramiding, which is slowly increasing the dose or frequency of abuse, reaching the peak of amount, and then gradually tapering off. So how widespread is the problem? Well, here in America, 1,084,000 people use anabolic steroids, and the age range of the group that abuses anabolic steroids is typically 18 to 34 years old. And we especially see steroid abuse in professional baseball, where there have been countless reports of players taking steroids and other performance-enhancing drugs. So anabolic steroid addictiveness and withdrawal. Even though the psychological and especially the physical problems are considered, the abuse of steroids is still very high. People who abuse steroids can experience withdrawal symptoms such as mood swings, fatigue, loss of appetite, sleeping problems, decreased sex drive, and steroid cravings. And one of the more serious withdrawal symptoms is depression, which can sometimes lead to suicidal attempts. So the physical side effects, some are high blood cholesterol levels, thinning of the hair, severe acne, such as we see on the right hand side, HIV, and other bloodborne diseases from sharing infected needles, and sexual and reproductive disorders. So psychological effects include impaired judgment, depression, nervousness, extreme irritability, delusions, paranoia, and the most commonly heard, which is road rage. The road rage is extreme mood swings, which includes maniac-like symptoms leading to violence. So the treatment for anabolic steroids, some people have found that behavioral treatment is helpful, and in severe cases, people take medication to help with the symptoms of withdrawal, such as antidepressants, pain medications, and medicine to help restore the patient's hormonal system. And that is the end of my presentation. Thank you very much.